Hello, my name is Dennis Gillette. I'm a physical therapist here at Center for Physical Rehab, or CPR. We're going to talk about how somebody would learn how to walk with a prosthesis. When I started physical therapy back in 1987, I worked at a rehab facility in Boise, Idaho called Idaho Elks Rehab, and I was trained in prosthetic gait training, or teaching people how to walk with a prosthesis. That entitled going to Chicago for a week, and I went to a place called Northwestern and Rehab Institute of Chicago. Basically, that's where my career with prosthetics started. After that, I always had either 1 to 5 patients a day on my schedule, and basically our goal was to teach them how to use a prosthesis and return to normal life. I've been working with prosthetics my whole career, and by far it's the most gratifying endeavor a physical therapist can make. And what I tell people is I'm basically teaching somebody how to walk again with a prosthesis and getting back to normal living. So as far as on the gratification scale, that would be 100% gratification if you are doing physical therapy for a living. When we see patients with amputations, usually we get to see them anywhere from 2 to 4 weeks after the amputation, and we'll work with them a couple visits, maybe a month at the most, getting them ready to have full motion in their legs, full motion in their back, and full strength in their legs to prepare for a prosthesis. At that point in time, they would go to the prosthetist, and the prosthetist would fabricate them a leg, whether it would be full leg prosthesis, partial leg prosthesis, or maybe even 2 prosthetics. At that point in time, we would initially see them the very next day after they receive their prosthetic devices, because we start the process of teaching them how to walk. Kind of the beauty of today's technology is my job is very simple in the fact that I don't have to retrain somebody how to walk. I actually tap into normal movement that they've done their whole life. So because of technology in materials, and because of technology in onboard computers, the prosthetist is actually making a prosthesis that moves normally, almost exactly like they were walking with their prior leg. So my job is to tap into normal movement, teach somebody how to weight bear normally, teach somebody how to walk normally, which means maybe with a device like a walker, or maybe with a cane, and then the ultimate goal to walk without a device in their arms. So the nicest part about my job is the sky's the limit. I get to push people to their potential of using a prosthesis for getting back to work, getting back to mowing their lawn again, getting back to doing activities maybe such as playing basketball, maybe getting back to hunting, fishing, the things that make life so enjoyable. So usually if we work with somebody for 1 to 3 months after they get their prosthesis, we're usually at a point where we can see them on a as-needed basis after that point. And over time, we get to see them doing the things they used to do with a prosthesis. So we encourage you to check with us if you are learning or wanting to learn about how to walk with a prosthesis, because that is definitely one of my passions. I've been doing it since 1987. It gives me the most gratification possible as a physical therapist.